Hello down here, welcome to Podiatry Practice Mastery. I'm going over this $1 million practice formula today. I'm starting on chapter 7, and this is one of my favorite, I guess, I don't know if it's an invention, but it's something that's really helped me communicate better and really obtain better acceptance from patients in my office. And this is what I call as a treatment sheet. So I call it the $200,000 communication tool. So one of the biggest mistakes I made early in my career was assuming that patients remembered everything that I told them. A patient would come in for a certain condition. I used to spend a lot of time talking to them about the condition, and I kind of went over the options, and they were always confused, and they didn't really take my recommendations. And what I found is that even though I can spend time using diagrams, answering questions, they nod politely, but then they walk out of the door and they forget or they don't do what I tell them. And I know this because patients would come back 2 weeks later and they'd say something like, "Doctor, remind me again what exactly was wrong with my foot." That's when I realized something important. Just verbal explanations weren't enough. I needed a simple visual tool. And I put these into something I call a treatment sheet. And this converted confused patients into confident patients. So the real problem with verbal explanations is that many times we use complex terminology to explain things. We'll talk about plantar fascia or tendon degeneration or biomechanical instability. But they hear something different. All they hear is confusion. And when they're confused, they hesitate to start the treatments and then they forget the plan. So neither of them really works. So there was a simple solution. And my first one was pretty rudimentary. If you've listened to some of my things before, actually my first solution was something I call a patient presentation. And this was a PowerPoint that I used to do and share it with patients. But this was more like talking to them instead of having this treatment sheet. I find that the patient presentation was good to show, but then I put it on a piece of paper on this treatment sheet. So if you want to learn about patient presentations, there's a whole other resource called patientpresentations.com. You can go, you can listen to it, you can make your own. I still use them. But what I find even more beneficial is this one simple sheet. So it's a one-page document that explains about the condition and explains about the treatment. And when I say it explains about the condition, it's not really explaining everything about plantar fasciitis. Sometimes I put a frequently asked questions on the back of it. Sometimes there's a QR code that links to a page on my website. But the more important thing is I go through the different types of treatments for this. Okay, so the treatment sheet is divided into different areas, and I can show them. So let me give you a couple of examples. Once again, if you want a link to mine, you can send me an email down at Podiatry Practice Mastery. Ask me which one you want. I usually make them on Google Docs, and I give access to my staff so they can print it out. And so the most common ones that I use are for plantar fasciitis, Achilles tendonitis, and nail fungus. Those are the most common ones. I have them for other conditions. Like if I have a Seavers patients, I have one on for Seavers. I have one for neuromas, and occasionally I'll use them. But the things that require more kind of complex treatment, I find that the treatment sheets work a little bit better. So on them, I have the name up top. I have things that patients usually try before they come and see me, so there's a little line. So you've probably tried icing, anti-inflammatories, new shoes, shoe inserts. And then I divide it into categories. So I've tried a lot of different ways of doing this. I've tried phase 1 and phase 2, meaning these are the phase 1 things you're going to try, these are phase 2. I find it just works pretty well to go through categories for patients. And I walk them through and I tell them what they need. But also, more importantly, I tell them what they don't need. So basically, I'm taking the sheet and I'm prescribing what I'm recommending for their treatment based on their condition. And this one sheet, this is why I'm able to do so many x-rays, not just x-rays. X-rays are pretty automatic, but how I can do so many ultrasounds, how I can do so much Shockwave, how I can do all these high-ticket items because they're right on this treatment sheet. And I just go through there and I say, okay, well, yeah, there's 3 things that cause, let's take an example, like plantar fasciitis. You have to reduce the inflammation, you have to reduce the stress and strain on the foot, and then you have to loosen up the back of the calf, okay? Or stabilize, then you have to stabilize the foot. So to reduce the stress and strain through it, the tightness, I have my on there, I have the morning stretch, which you've heard me if you've heard me talk about this, but it talks about doing a morning stretch, talks about doing a foam roller, and then it talks about doing a night splint. So if it's bilateral, they're going to do this bilateral and get bilateral night splints. And then I say, and my staff is going to go over this with you, and they kind of instruct them how to do this. So that's how every single one of my patients, they buy a foam roller, and every single patient gets at least 1 or 2 night splints. So that's for plantar fasciitis and Achilles tendonitis. The second aspect would be to reduce inflammation, and that's usually the initial part is going to be anti-inflammatories, icing or contrast baths. On that list, I also have written cortisone injection, I have written on the Shockwave, and I have written on amniotic injections. So all of these things are on there. Not saying I'm going to do them. Many times patients don't want cortisone, so I cross it out. I also don't think it's as effective, so I might review it. I'll say we can do cortisone if the pain is really bad, but a lot of times the pain comes back after about a month. And I usually start with like phase 1 treatments would be the icing, anti-inflammatory. Same thing when you get down to the foot gear, to taking pressure off the fascia. I'll use my example, but then on there you have over-the-counter inserts, you have certain shoe recommendations, you have custom orthotics, and you have AFO braces. And then there's also a section that talks about imaging like ultrasound, and then there's some advanced treatments like MRI, surgery, like AFO type of braces and things like that. So with this treatment sheet, I know it sounds a little confusing to explain this to you, but it really simplifies things for patients, because I can check what they should start with, and I could cross out what I don't think they need or they're going to need. And for a lot of patients, when you cross out surgery, they're like, whew, I guess I'm not going to have surgery. Or you cross out a cortisone injection, they feel better that you're crossing that out. So another thing it does is it increases the ease of acceptance, and especially when you're doing packages. So what I mean by packages, there are certain things that all of my patients with Aquinas get. They get the night splint, foam rolling, and morning stretch. They call it the Pelto special here in the office. So we have to have these packages that patients get. Another similar thing on my treatment sheet for nail fungus, when they come back in after the nail sample, I go over it and I say, okay, we have the best option, which is laser, because there's no liver monitoring, nothing like that. It's not the most effective, but it's the safest. Then we have the oral, and then you have the topical. I don't really talk about much topical. Most of patients do the oral, and some patients do the laser. And I say the step down from that is going to be, if the laser doesn't work, then we're going to go to the oral. When they get any of those treatments, I also have written on that sheet that they're going to do biotin, okay, or Theranil. They're going to do a UV light once a month, and they're going to do a shoe spray once a week. They're going to wash their towels and socks, and they're going to clean out and bleach their bathroom. So all this is written down. So not just things that they're buying or treatments I'm doing, but other requirements that I recommend to help them get better. And so I have all this written on there, and I check it. So they have a whole plan. I think one of the challenges with a lot of people when you're talking about dispensing things in the office is that they are just randomly saying, okay, you're going to get this, and patients don't understand, well, how often do I use it? Why do I have to use it? What's it going to do? What's the purpose? There's a lack of clarity. They're just thinking that the doctor is trying to sell them something, whereas there's no clarity about doing that. So I find with these things, I'm very clear, and I think clarity beats everything else, and this is something that's taken years to understand. So they're going to get the UV light, you're going to use that once a month, and you're going to put it in your shoe. You're going to get the shoe spray. You're going to use it once a week for odor, and then you're going to take the Theranil and the terbinafine, once a day. And then when I see you back, I'm going to alter the prescription a little bit. So I kind of explain all of this, and then I also have a QR code where they can watch a video that explains the whole thing as well. Because patients, once again, aren't going to remember. I'm explaining it to them the first time, but they've never heard it before, and they're probably going to forget it. So this really helps. They can use these treatment sheets to show their spouses, their family members, and other type of people. So it really helps increase the expectation and acceptance. So my mistake for years, I was using I didn't use these sheets. I didn't think they were perfect. I didn't think they were good enough. And when I finally started to implement them, I found it worked a lot better. So there's a couple kind of tactical things. In one of my offices, I have a folder where they're all in there, and my staff just grabs them for me. In my other office, I have little folders within each treatment room, and I have a stack of the most common ones that I use. So this has really helped. If you imagine, like what it used to be, is I used to, let's say, talk about oral antifungal. They used to just get the antifungal and that was it. Now, with this kit, with the 2 bottles of the Bite and the UV light and shoe spray, it's all about $200. So it takes an office visit that was just a prescription, and it goes to about $200. And that's a low margin. When you start talking about doing other things like shockwave therapy or amniotic injection or custom orthotics, that can take something that used to be just a cortisone, which might reimburse $100, and then something with an ultrasound and all that, it could go up to about $3,000. And one thing I talked about before was my MVP, and these would be my MVP. The MVP patients are the ones that I'm taking time and making these sheets for, and these are, for me, basically, it's the ones that I'm going to be using for Shockwave. But it could be anything else that you do. And some people are questioning, like, how is it that patients, how is it an MVP when they pay as they go? So this is something I wanted to address quickly, because when I see patients, Shockwave is $250 a session for me for 1 foot, and then $500 for 2 feet. And what happens is when I give them an option. They can pay as they go, or if they do a prepay, they can get 10% off. So I do this for anything. I do this if they're going to get a big package of things, like they're going to do amnio, shockwave, and the orthotics. I'm fine with giving them 10% off, just because it makes it a lot easier and sets things up, and it's a benefit to me. Okay, so after explaining the diagnosis, I say I'm going to give you a simple sheet, and this explains everything we just discussed. And this way you can review it at home and follow the recovery plan. So these work because they simplify complex information and they standardize how conditions are explained, and they reinforce the treatment plan. So what I would recommend is I'd take, like, what are your most valuable patients, your top 3 to 5 diagnoses. Make a simple treatment sheet and then start using them consistently, because I think this is going to really help you with your patients. It's going to make things much more profitable for your practice. Once again, if you want all of these, you can certainly shoot me an email. I have a couple of other programs that I have that you could learn about these treatment sheets. But shoot me an email, Don@PodiatryPracticeMastery. I'm happy to send them over to you. I hope that can help your practice. Now, if you want this whole book, you can go to podiatrypracticemastery.com/book, and you can download the whole PDF of this book. But I think the audio is a little bit better because I add my little riffs within the book. Okay, talk to you guys soon.